High five!
In this video, we are going to learn an easiest mnemonical way to remember the list of autosomal dominant disorders. Autosomal dominant disorders refers to a group of disorders in which a gene is altered and the altered gene is located on one of the non-sexual chromosome, and our non-sexual chromosome is also called as autosomes. Here, the autosome is altered by its gene and it is dominant. So thus we call this condition as autosomal dominant disorders. Here comes the list of autosomal dominant disorders. Von Willebrand disease or von Hippel disease, pseudohypoparathyroidism, dystrophia myotonica, osteogenesis imperfecta, Marfan syndrome, intermittent porphyria, neurofibromatosis, achondroplasia or adult polycystic kidney disease, Noonan syndrome, tuberous sclerosis, hypercholesterolemia, Huntington's disease, hypertrophic obstructive cardiomyopathy, hereditary spherocytosis, and hereditary non-polyposis coli, hereditary hemorrhagic telangiectasia. So these are all the list of autosomal dominant disorders, and here is an easiest mnemonical way to remember the list of these diseases. Here the mnemonical term is very powerful dominant human. So very powerful dominant human is the mnemonical line to remember the list of autosomal dominant disorders. So here V for von Willebrand disease or von Hippel disease, and P for pseudohypoparathyroidism, D for dystrophia myotonica, O for osteogenesis imperfecta, M for Marfan syndrome, I for intermittent porphyria, N for neurofibromatosis, A for achondroplasia or adult polycystic kidney disease, N for Noonan syndrome, T for tuberous sclerosis, H for hypercholesterolemia, again H for Huntington's disease, hypertrophic obstructive cardiomyopathy, hereditary spherocytosis, hereditary non-polyposis coli, hereditary hemorrhagic telangiectasia. So from the line very powerful dominant human, we can remember the list of all autosomal dominant disorders.
Wow, it's very nice.